Now we're going to talk about what works as an additional treatment for Achilles tendinopathy, right? So again, and I already spoke to you about this, but a lot of the research of these different treatments, right? There's not a ton of great research to show they work well. All right. So when you're talking to your patients about these additional treatments, when conservative treatment fails, just have to have this shared decision-making process and let them know what we do and don't know about these treatments and how effective they are, right? So you might have a patient that fails conservative treatment, and all of a sudden they're like, all right, what's the next step? I want to do surgery. Well, we're not sure how effective surgery is. So it's not like if you fail your conservative treatment, surgery is definitely going to work. Patients need to understand that. Okay. And the same thing goes for different types of treatments we'll talk about below. Okay. So we're uncertain about all the effects of these treatments. So shockwave therapy is something that may work in folks who have Achilles tendinopathy, and the authors recommended at least 3 sessions performed with physical therapy, right? PRP injections or other sorts of orthobiologics may be effective. However, the research here is conflicting. Okay, so the authors of this paper couldn't advise for or against these treatments, but what's at least kind of nice in Achilles tendinopathy and orthobiologics seems like there's no side effects, right? So it's not like you do a PRP injection and then your Achilles is going to rupture, all right? It doesn't seem to do that. They can be painful and it can be costly. So it's important that your patients know that this may be something that's helpful for you, but we're not sure. And the other piece that it's probably going to hurt, right? And it costs a lot of money. All right. So again, shared decision making with your patient. And lastly, what else can you try that has mixed evidence for its support? Things like night splints, inlays, collagen supplements, ultrasound, friction massages, laser, and light therapy. Something like a heel lift is another easy thing you can give a shot. That's not it's fairly conservative and not invasive at all. So again, just make sure that your patients know that we're not exactly sure how well these work, and there's something to try after you've kind of exhausted the low-hanging fruit. So if nothing works over the course of time, should you consider surgery for Achilles tendinopathy? So again, we're uncertain of the effects of these surgeries. It hasn't been studied as well as we'd like. Okay. So make sure that your patients understand that before they just go under the knife, expecting that this is going to fix their problem 100%. Okay. So first and foremost, you don't want to recommend any sort of surgery or surgical consult. So if you're a physical therapist, right, you're not going to outright say, I want you to do surgery. You're going to send them to a surgeon, and the surgeon and the patient can make that decision over the course of time. Okay. You want to have at least 6 to 12 months of no progress. So despite everything you threw at it, the entire kitchen sink, you're not making any progress whatsoever. Make sure your patients know that over the course of time, if your symptoms are going down, great, continue with exercise. If you're not back to 100%, it doesn't mean you need surgery. It may mean you just need to be patient, continue, right? So again, lack of high quality research to show that surgery is effective for Achilles tendinopathy. What they end up doing in Achilles tendinopathy is going to vary based on whether or not you have an insertional issue versus a mid-portion issue. If you have a mid-portion Achilles tendinopathy, the surgery generally involves some sort of debridement of pathological tendon. Keep in mind that there are multiple different types of treatments that you can do. So the research is kind of mixed in terms of the types of surgeries that people undergo. But largely those surgeries are going to have some sort of debridement of the pathological tendon. In folks that have insertional Achilles tendinopathy, usually surgery is going to involve excision of the retrocalcaneal bursa, as well as taking away Haglund's deformity. So basically, you can grow additional bone on the calcaneus over the course of time. And generally, surgery for insertional Achilles tendinopathy is going to have the Haglund deformity removed, right? Or taking part of that away. Okay. The other piece, and obviously this you realize this, but surgery has complications. All right. And one of the bigger complications with Achilles surgery is that the Achilles tendon skin, so the skin above the Achilles tendon, doesn't heal as well as other parts of the body. Plus, if you're putting stress on your foot, there's a chance that the wound can separate and then you can have an infection. So around 10% of Achilles surgeries end up with an infection. Infections are never good, right? So there is a risk of getting that with surgery. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain-free mini course. Definitely check this out.